My name is Diane Huss. I'm a doctor of physical therapy. I specialize in neurologic conditions, particularly movement disorders. I'm a board-certified neurologic physical therapist. And I've had the great good fortune to work with Dr. Elias over the last 8 years in his functional neurosurgery movement disorders clinic. It's a multidisciplinary clinic with neurologists and neurosurgery and physical therapy and nursing services. So it's been a wonderful collaborative effort, and it was a natural evolution when Dr. Elias, as part of his work with movement disorders, looked at how to implement focused ultrasound as a potential treatment for essential tremor and other movement conditions. So my role is to assess the patients. It's an extension of what I've been doing with patients that have deep brain stimulation or other types of functional neurosurgeries. We're only treating one hand. So because of the considerations with the procedure, we're using their dominant hand, which in all cases has had the worst tremor for the first 15 people we've seen. But being able to have the use of one hand in our experience has made a significant difference, where people are able to do the things that we forget are everyday kinds of things. As part of my assessment, I ask every patient to identify 3 personal goals. If you call this procedure a success, what would it be? What would it look like to you? And the answers have been quite interesting. Some of them are similar. It's been, as I go through it, use a screwdriver comes up frequently. Being able to eat without spilling. We take that for granted, that you can eat without spilling. Being able to walk across the room and carry a cup of coffee. I want to be able to bring a cup of coffee to my wife. I want to be able to sit at the table and serve food. I want to be able to cook from a recipe and measure out what I'm going to make. And of course, some of the more emotional ones, being able to write a letter, handwrite a letter to my sons and my grandsons that are serving in Iraq and Afghanistan. It was quite heart-wrenching. Have had people that have been able to continue their work because their drafting architecture jobs require precision handwriting that they weren't able to do, and they've been able to sustain that work. Another gentleman who's a postal worker, able to bundle up his mail to do the things he needs to do. Even just with the one hand treated, he's able to do those things. But mostly it's the basic life activities, brushing their teeth, sitting at the table, eating a bowl of soup, and not being self-conscious and worried about spilling and feeling like they can eat out in public. I really admire how brave these patients were. You know, they were all the risks for the procedure were described for them, and this has not been done targeting this way, looking for essential tremor. It's the first place in the world that this happened, and not knowing exactly what to expect from our end, and the patient certainly not knowing what to expect. They're a wonderful group of people, every one of them. They're all have unique aspects in their lives, and they all came to us through a different path and had different reasons for being here. And it was a very emotional, connected experience, and great to see the immediate outcome for folks.